potassium and calcium, which is we covered very briefly. There'll be more on that. Both affect the heart muscle pretty dramatically, and the relationships are entirely about membrane potential. Okay, that wasn't a wasted learning or lecture, right? Membrane potential really does matter. Here's an example. Okay, so when potassium levels in the extracellular fluid are too high, if you do the layout, that's going to mean less of a concentration gradient, right? Because we have high and higher than normal, so it's less of a gradient. Less of a gradient means that the membrane potential is higher, it's depolarized. That makes the heart sort of twitchy and too easy to stimulate. So what we see is when potassium levels are elevated, and actually elevated, not just lab error elevated, okay, when they're actually elevated, we see changes in the EKG that look a little like a sawtooth because the heart is twitchy. It's a little quick to contract for a given degree of depolarization. So that's too high. When potassium levels are too low, we have a greater concentration gradient. So we end up with hyperpolarization. And it becomes more difficult to depolarize the membrane, heart rate drops. Calcium can also play a role, which shouldn't surprise you, right? The action potential plateau of the cardiac muscle is from calcium entry. Well, if calcium ion in the extracellular fluid is too high, we're amplifying our concentration gradient, causing more contraction and worse, a tendency towards spasticity. The last thing we want is a heart that just contracts and doesn't relax, right? It is this methodology by which calcium is used to stop the heart, okay, which is used in lethal injection. It's also sometimes used in euthanasia of very large animals. Deficiency of calcium ions in the ECF would also limit the ability to contract because there's not enough calcium is coming in. The interesting thing is we really don't see this in people very often, and that's because we walk around with 10 to 20 pounds of calcium all the time in us. So if the body needs calcium, if this is the situation, it's going to steal it from your bones. The only way you're going to get that kind of hypocalcemia is if you have some hormone defect that's preventing calcium from being released from the bones. So in other words, a parathyroid hormone problem.